you to crack the code of your sleep and dreams so you can sleep sound and dream deep. This evening, I'm continuing my look at unusual sleep problems, subject sleep apnea. Now, sleep apnea is a quite serious sleep disorder which occurs when a person stops breathing for whatever. Now, if it can happen once during a night, it can happen even hundreds of times during a night, and which in turn means that the body and the brain in particular are being starved of oxygen. There are actually two types of sleep apnea, the first being obstructive sleep apnea, which is the more common form, and this is caused by a blockage of the airways, usually when the soft tissue at the back of the throat collapses during sleep. So like your tongue relaxes or the palate for some reason collapses and blocks off the air passage. The other form of sleep apnea is called central sleep, which, although the airway is blocked, the brain fails to signal the muscles to breathe. For some reason is due to an instability in this control center that common sleep apnea symptoms that you may notice if this is a problem for you is waking up with a throat, loud snoring, occasionally waking up choking or gasping, sleepiness or lack of energy during the day, sleepiness while driving. I mean, if you've ever pulled an all-night or something like that, you'll know how easy it is to fall into this monotonous pattern and fall asleep. Morning headaches can also be an indicator that sleep apnea is a problem. Restless sleep, though there may be various causes for that. Forgetfulness and mood changes, and a decreased interest in sex. If you're not sleeping well, you're not going to be getting up to anything. Or current awakenings or insomnia itself. So physically, sleep apnea affects us besides the lack of sleep in various ways, including increasing the risk of various health problems, including high blood pressure and stroke, heart failure and other heart issues, including irregular heartbeats and heart attacks, diabetes, depression. If someone is suffering from ADHD, it can worsen it, and headaches. Those are some of the side effects, if you will, of sleep apnea. In addition, untreated sleep apnea may actually be responsible for poor performance in everyday activities such as work or school. It can be implicated in car accidents or of various situations, as well as school in children and adolescents. So it really does have a major aspects of our lives. Now, there are certain groups that are more at risk for sleep apnea than others, but risk factors for sleep apnea include being male and being overweight, being over the age of 40, and having a large neck size. That surprised me a bit, but if that's 17 inches, and don't ask me how many centimeters that is, that's roughly about 8 centimeters, I think. If 17 inches in men, if their neck circumference is 17 inches or greater, and 16 or greater in women, they're at greater risk of sleep apnea. Enlarged tonsils, a large tongue, or very small jawbone, narrow jaw, may be responsible for causing sleep apnea. Family history, of course. If there's a history of sleep apnea, it can run in families. And blocked passages, whether that's due to a deviated septum, allergies, or sinus problems of some kind. Now, there, if you, well, can't talk. If you're it may be a good idea to talk to have a phone consultation with your doctor or consultant, and who may actually ask you to have a sleep apnea test, which is called a polysomnogram. And it's a test that can be done in a clinic or at home. And if sleep apnea is indicated, there may be various methods that may be used to deal with it. Now, what kinds of treatments are available for sleep apnea? Treatments can include things from lifestyle changes to medical devices to actual surgery in extreme cases. So it depends on the particular situation of the person involved. But there are several things that you can do in terms of self-care that can be helpful with regard to sleep apnea. The first of these changes, which are lifestyle changes really, is to lose weight. That's not to say that all people with sleep apnea are obese or overweight, but about half of them are. So if you're carrying extra weight, slimming down would probably be a good idea and would be improving the symptoms. Now, there's another thing that can be done is to limit alcohol and to stop smoking. Well, we already know that drink too much alcohol and cigarettes are not good for us. But did you also realize that these two factors can actually make your sleep apnea symptoms worse? They can. Cigarette smoking, for example, increases swelling in your upper airway and can aggravate symptoms like snoring and pauses in breathing. Alcohol, on the other hand, decreases the muscle tone in the back of the throat, relaxing it. It's a relaxant, which can, and this relaxation can interfere with the airflow into the lungs. So, which is the last thing you really need to have happening when you're already dealing with breathing problems. Another thing that you might not have considered is taking care of allergies, any allergies that you may have. I mean, if your nose is already blocked because of pollen or dust mites or whatever the case may be, it's only going to environment that's more conducive to some problems like sleep apnea. So if you have nasal allergies or something that irritates you in your home or your work environment, it may be a good idea to get them under control, whether it be by taking antihistamines or using other methods that, such as homeopathy or other methods to be able to control the symptoms. You can also, by regularly washing out the nasal passages by the use of a neti pot, or just simply taking a bit of warm water with a little bit of salt in it and snuffling that out that may be causing an allergic reaction. Medication is also a possibility. There's various drugs that can treat the sleepiness that accompanies sleep apnea. But the best thing is to actually get with your doctor and let them, after testing you and determining whether you actually are suffering from sleep apnea, to find out what methods work best. There are also things like oral appliances, things that you can, dental devices to use in your sleep. And dentists that are experienced in these types of appliances can make one up especially for you. The worst case scenario is surgery. And if you're suffering with a medical condition, for example, that makes your jaw, your throat too narrow, or if you have enlarged tonsils, very small lower jaw with an overbite, or what they call a deviated nasal septum, which is when the walls between your nostrils is off center somehow, which can also cause a problem. Those are it does because you are having problems in your sleep doesn't mean that it's something that's necessarily life threatening, but it is something that you should check out. It may be simple things that you can do, like cutting down um, on your calorie intake so that you can lose weight, or to get help with stopping smoking, or to reduce your drinking, can all help. But there is help, medical help, if it's required. But if you're having trouble sleeping and you're really not sure what it is that's causing the problem, find out. Give me a call. I offer a complimentary slip into sleep session where I can do an assessment with you and find out exactly, pinpoint exactly what is causing your sleep problems. It may be something very simple. It may be something that requires the treatment from a doctor or a specialist. But until you know, you're not able to deal with it. So if you'd like to find out exactly what's happening with your sleep, as I say, contact me. You can contact me at www.meetingwithsheila.com and book a free session and get some free advice that will help you get you sleeping better immediately, as well as finding out what it is you can do to help yourself. Thanks so much for watching and listening. Have a fantastic evening and a great week to come. The weather's supposed to be nice, so enjoy as much as you can and stay safe. Take care. Bye-bye.